Okay, imagine this for a second. A single government policy, one policy that has cost American taxpayers something like $9.7 trillion over just 70 years. And maybe even more astonishing than the price tag, it has demonstrably failed to achieve its own stated goals, like reducing drug use or enhancing public safety or improving public health. Welcome to the Deep Dive. This is where we take complex information, often from dense research papers or reports you send us, and we really dig in. We pull out the crucial nuggets, the insights, and turn it into, well, hopefully a compelling conversation. Our mission really is to give you a shortcut to being genuinely well-informed. We aim for those surprising facts, those insights, and, just enough context to keep you hooked. Today, we're plunging into a really fascinating, groundbreaking working paper. It's titled Drug Policy Reform and Integrated Economic Governance, and it's co-authored by Duke Johnson and Claude AI. And this deep dive, we've tailored it especially for you if you're, say, a policymaker, maybe a journalist or an economist, anyone keen on really understanding the true costs and maybe some transformative alternatives to the way we currently handle drug prohibition. So the paper argues pretty forcefully, I'd say, that the United States' 7-decade approach, this prohibitionist drug policy, well, it hasn't just been an astronomical financial drain, it's also fundamentally failed on its own terms.
That's right. It's a stark indictment, really. The failure isn't just marginal. The paper argues it's systemic across its primary goals.
But here's where it gets really interesting, I think. The authors don't just stop at diagnosing the problem, they propose a solution. And it's pretty radical, an integrated solution.
It is. They envision drug policy reform happening within these innovative governance systems. Things like creative currency octaves, or CCO, public trust foundations, PTF, the Citizens Internet Portal, CIP, and social zone harmonization, SZH.
Now, for those of you who've been with us for previous deep dives, you might remember we explored CCO and PTF before. We went into quite a bit of detail on those foundational concepts. But if you're new, don't worry. We'll give you enough context today so you can really grasp why these systems are so pivotal, so central to this transformative vision for drug policy. So our journey today, we're going to try and illuminate the staggering, comprehensive costs of just keeping things as they are. We'll look at compelling lessons both from history and from what other countries are doing right now.
Right. We'll look at those international models, historical parallels.
Exactly. And then we'll project forward. What could the economic, the health, the social benefits look like under this integrated approach? By the end, you should have a really clear understanding of what's at stake and maybe, just maybe, what incredible possibilities lie ahead if we rethink things.
Okay, let's unpack this first part then, the cost. The paper lays out this really stark reality of what the war on drugs has truly cost America. 7 decades. It's not just a social issue, right? It's an economic quagmire.
It really is. And the paper's cost analysis is incredibly detailed. It tries to be comprehensive, looking beyond just the obvious budget lines.
So what's the big number, the headline figure?
Headline figure is $9.7 trillion. That's in 2024 dollars, spent specifically on drug prohibition, estimated from 1971 right up to 2024.
9.7 trillion.
Okay.
It's hard to even wrap your head around that kind of number. It is. And to put it in perspective, the paper estimates it represents roughly maybe 8 to 12% of all combined federal, state, and local government spending over that entire 70-year period.
8 to 12% on this one policy area.
Yes. That makes it one of the largest, most sustained policy investments in American history. And yet, as you said, the stated goals, reducing drug use, improving safety, the evidence suggests they haven't been met. It's a colossal misallocation, the paper argues.
Okay, so $9.7 trillion total. That's the big picture. Where did that money actually go? Can we break it down a bit more?
We can. A huge chunk, over $3 trillion of that, went into what the paper calls direct enforcement expenditures.
Right, like police, courts, that sort of thing.
Exactly. Federal spending alone, when you adjust it for inflation to today's dollars, is over $2.1 trillion since 1971. Think about specific agencies like the DEA, the Drug Enforcement Administration. Their budget in fiscal year 2024 was around $3.3 billion. The paper does a quick calculation. That works out to roughly $6,300 every single minute.
Wow. $6,300 a minute just for the DEA?
Just for the DEA's budget, yeah. It gives you a sense of the scale of ongoing direct federal spending focused purely on drug enforcement.
And that's just the federal piece. What about states and local governments? Because they bear a lot of the brunt too, don't they?
They absolutely do. That adds a substantial additional burden. Analyzing state budgets, the paper estimates an average annual spend of about $25 billion just on police drug enforcement activities.
Right.
Narcotics units, investigations.
Right.
plus another $15 billion or so annually in court processing costs directly related to drug cases, arraignments, trials, public defenders.
So add that up over 70 years.
Exactly. When you adjust for inflation, state and local enforcement costs come out to approximately $1.3 trillion over that period. So yes, massive ongoing direct spending at every level of government, year after year, funding this prohibition approach.
Okay, so direct costs, police, courts, federal agencies, that gets us over $3 trillion. But the paper really hammers home the cost of the prison system itself. It's not just building cells, is it?
Not at all. Incarceration infrastructure and operations are a massive driver of these costs. Maybe the most devastating part, arguably. The paper highlights that about 40% of the, let's say, $1 trillion spent directly fighting the war on drugs. The enforcement piece, about 40% of that is tied to incarceration costs.
So around $800 billion just for the prison aspect of drug enforcement.
Roughly, yes, over that period. And this reflects a huge historical trend. The U.S. prison population exploded, right? It went from about 500,000 people in 1980 to 2.3 million by 2020.
Massive increase.
Huge. And drug offenses were the primary persistent driver behind that expansion. Building each prison bed costs, on average, around $150,000. And then you have the annual running cost, staff, food, healthcare, about $35,000 per prisoner per year.
So it's not just the initial arrest and trial, it's this long tail of costs that goes on for years, even decades.
Precisely. It's a massive self-perpetuating system. It just keeps draining public resources long after the initial arrest.
Okay, billions for enforcement, hundreds of billions for prisons. But the paper also talks about these hidden costs, collateral social costs, it calls them. What exactly falls under that category?
Right, and these are in many ways the most tragic costs. They total nearly $2 trillion in current dollars, according to the paper's analysis. These are the impacts that don't show up directly on a budget sheet, but they deeply harm communities and echo through generations.
So what kind of impacts are we talking about?
We're talking about things like intergenerational cycles of poverty. When a parent is incarcerated, especially for a long time, it destabilizes the family financially, often permanently. We're talking about family separation itself, the trauma that causes. Community disruption when large numbers of people, especially young men, are removed. And the impact on children is particularly stark. The paper notes that children of incarcerated parents often face increased behavioral problems. They struggle more in school, and sadly, they have a higher likelihood of ending up involved in the criminal justice system themselves later on.
Is there a way to quantify that?
The paper cites economic analysis, suggesting that each drug-related incarceration generates about $127,000 in these kinds of social costs, effects on families, communities, future outcomes.
$127,000 per incarceration.
Yeah, and when you consider there have been approximately 15 million drug-related arrests since 1971, well, you can see how it adds up. These aren't just isolated incidents. They're persistent, compounding drains on social services, education, and overall economic productivity. It's a huge burden that lasts long after someone serves their time.
And then there's the other side of the ledger, isn't there? What we lost, the opportunity costs. What could we have gained if things were different? For an economist, that must be a key part of the calculation.
It is, and perhaps the most significant element, the paper argues. These opportunity costs and foregone benefits total roughly $3.5 trillion, and that's primarily lost government income, foregone tax revenue.
Because you can't tax an illegal market?
Exactly. Prohibition fundamentally prevents the government from capturing the economic benefits that would naturally arise from regulated drug markets. The paper uses the example we see now in states like Colorado or California with legal marijuana.
Right, they're bringing in substantial tax dollars.
They are. And creating legal jobs, boosting local economies. The paper projects that nationally, if you applied a similar regulated model to all currently prohibited substances, you could potentially generate $75 billion to $125 billion annually in tax revenue.
Annually, yeah.
Annually.
Yeah.
And create somewhere between 800,000 and 1.2 million legal jobs. So over 70 years, that $3.5 trillion figure is just the lost tax revenue. It doesn't even count the trillions more in uncaptured economic value, suppressed legal employment, businesses that never started, innovation that never happened because the whole area was illicit.
So it's not just the money spent, it's the money not gained. A huge amount of potential wealth and opportunity is just left on the table.
Precisely. Wasted potential, essentially.
So let's take a breath here. What does all this mean for you listening? If you're a policymaker, a journalist digging into this, an economist studying it, it seems undeniable based on this paper's analysis. This isn't just a social issue or a humanitarian crisis. It's a massive, sustained economic drain. a policy with a profoundly negative return on investment.
That's the core argument. Trillions spent, trillions more in opportunity costs, rippling through every part of society: public health, social stability, economic growth.
Which brings us back to that initial point.
Right. It raises that fundamental question. Despite spending trillions, the stated goals, less drug use, more public safety, better public health, have clearly not been met, according to the data presented.
Okay.
The system shows systematic failure across efficiency metrics.
So the return on investment is negative.
The paper estimates it's negative $3.40 for every dollar spent on enforcement, when measured by positive societal outcomes. It argues the policy actively worsens public health. Look at drug-related deaths, up 340% since 1971, despite this massive spending.
How does it worsen health outcomes?
Well, by driving things underground. It accelerates the transmission of diseases like HIV and hepatitis C through unsafe practices, criminalizing clean needles, making people afraid to seek help. It creates huge barriers. So yeah, the picture painted is a policy that's not only costly, but actively counterproductive, even on its own terms.
This all sounds disturbingly familiar, actually. The paper makes this really compelling historical comparison, doesn't it? It argues this isn't the first time America has gone down this road.
That's right. It draws a direct parallel to the era of alcohol prohibition from 1920 to 1933. It really mirrors the costs and consequences we're seeing with current drug prohibition. It's a powerful, maybe cautionary lesson from our own history.
So what were the costs back then? Similar scale.
Relatively speaking, yes. Federal spending on alcohol prohibition enforcement hit about $300 million a year back then. Adjusted for inflation, that's roughly $4.5 billion in today's money annually.
Still a huge chunk of the budget back then, I imagine.
It was significant, consumed about 2 to 3% of the entire federal budget at the time, just trying to enforce this ban on alcohol.
And just like the paper argues about today, that enforcement effort had some pretty serious, often violent, unintended consequences, didn't it?
Absolutely.
Huh?
It inadvertently created these incredibly powerful criminal organizations. Think Al Capone, the speakeasies, the gang warfare. It led to unprecedented violence and political corruption as these illicit markets flourished and officials were bribed. The statistics are stark. Murder rates actually increased by 24% during the Prohibition years, largely linked to battles over controlling the illegal booze trade.
So more crime, more violence. What about public health? Did it actually make people healthier by banning alcohol?
Quite the opposite, tragically. Without regulated production, quality control just vanished. Bootleg liquor was often dangerous. Thousands died from poisoning methanol, other toxic adulterants mixed into the illicit booze. Production moved underground, completely unregulated.
And the economy?
Economically, it was disruptive. The legal alcohol industry, breweries, distilleries, bars, restaurants, disappeared overnight. That cost hundreds of thousands of jobs and wiped out substantial tax revenue that the government, especially during the looming depression, really needed.
Okay, so it sounds like a real-life case study in how not to do things. A policy aimed at, I guess, moral improvement that spiraled into a public health and safety nightmare. But the story doesn't end there, does it? The paper emphasizes what happened after repeal.
Exactly. The post-repeal regulatory success offers this crucial counter-narrative. Once alcohol became legal and regulated again after 1933, the benefits were almost immediate and pretty profound.
Like what?
Well, alcohol taxes quickly became a vital source of government revenue, really important during the Depression and World War II. Since repeal, those taxes have totaled over $500 billion in today's money, funding public services.
And the safety issues, the poisonings.
Quality and safety improved dramatically. Regulated production meant government oversight, labeling, standards. It largely stopped the poisoning deaths and ensured product quality. The criminal organizations, they lost their main revenue stream. Their power diminished significantly, leading to a substantial drop in organized crime violence related to alcohol.
And the jobs came back.
They did. The legal alcohol industry today employs over 4 million Americans. It generates hundreds of billions in economic activity every year. It basically transformed this chaotic, dangerous black market into a legitimate, taxed, job-creating sector of the economy.
It really is a striking parallel, a tragic blueprint for what not to do maybe, but also a roadmap for what could be possible. What stands out to you, our listener, thinking about this historical lesson? For me, it's how quickly those unintended consequences took hold, and conversely, how beneficial regulated markets became almost instantly after repeal.
It strongly suggests, as the paper argues, that current drug policies are essentially repeating those historical mistakes, almost point for point. The alcohol prohibition experience shows that regulatory alternatives aren't just theoretical. They offer proven, tangible benefits for public health, safety, and the economy. It provides this really important historical counterfactual to the current approach.
Right. It shows that criminalizing something people want often creates a black market that's far more dangerous than the substance itself.
Exactly, fostering violence, creating health hazards, whereas regulation, done thoughtfully, can potentially turn a societal drain into a benefit, jobs, taxes, improved safety, better health outcomes through control and education. The lessons seem pretty clear if we're willing to look at them.
Okay, so history offers a powerful lesson. But what about now? Are there modern, real-world examples of countries moving away from prohibition? The paper highlights several international case studies, right?
Yes, it does. And it focuses quite extensively on Portugal's experience, mainly because it's probably the most comprehensive and well-documented example of a country shifting its approach wholesale.
Portugal, what did they do exactly?
Back in 2001, Portugal implemented a really groundbreaking policy. They decriminalized the possession of small amounts of all drugs for personal use. The key shift was treating drug use primarily as a public health issue, not a criminal one.
So if you were caught with drugs for personal use, you wouldn't go to jail.
Correct. It became an administrative offense, not a criminal one. Instead of the court system, individuals were typically referred to something called a dissuasion commission, made up of health and social work professionals. The focus shifted entirely from punishment to support, treatment, and harm reduction.
That's a massive philosophical change. Punishment versus public health. What were the results? Did it work?
The results, according to the paper and the studies it cites, were profound and overwhelmingly positive. A major 2015 study found that the per capita social cost of drug misuse in Portugal actually decreased by 18% in the 11 years after the policy change.
Decreased. So it cost society less after decriminalization.
Yes, an 18% decrease after an initial 12% drop in the first 5 years. And this wasn't just about saving money on enforcement or incarceration. It was about improving lives and public health outcomes dramatically.
How so? What specific health improvements did they see?
Some really dramatic ones. HIV infections among drug users plummeted by 95% between 2000 and 2015, largely attributed to better access to clean needles, treatment programs, less stigma. Drug-related deaths also dropped significantly, falling from 369 in 1999, before the change, to 152 by 2003. That's a huge reduction, testament to the focus on harm reduction and getting people into treatment.
Incredible drops in infections and deaths. What about the common concerns? Did drug use go up, especially among young people? Did crime increase?
That's what many feared. But the data showed the opposite. For young people, Portugal actually saw a reduction in the prevalence of recent cannabis use, a delay in the age people started using drugs, and increased awareness of the risks among youth.
So decriminalization didn't lead to more kids using drugs.
The data suggests not. And on criminal justice side, the impact was also significant. The burden on courts and prisons related to drug offenses dropped dramatically. Court backlogs eased, prison overcrowding reduced.
Which frees up resources, presumably.
Exactly. It allowed police resources to be redirected towards tackling more serious, violent crime, which arguably improved overall public safety. And economically, the money saved from not arresting, prosecuting, and jailing people for simple possession. That was reinvested into treatment services, drug education, prevention programs, and healthcare. It really demonstrated the economic viability, even the superiority, of a public health approach.
And Portugal isn't alone in seeing benefits like this, right? The paper mentions other countries, too.
That's right. While Portugal is maybe the most comprehensive example because they decriminalized across the board, the paper uses other examples to show similar principles at work. Switzerland, for instance, has its well-known heroin-assisted treatment programs.
Where they provide medical-grade heroin under supervision.
Yes, to chronic users who haven't succeeded with other treatments. The results there were remarkable. A 60% cut in criminal activity among participants, a 50% improvement in their employment rates, and a 90% reduction in their use of illicit street drugs. It shows that even for substances often seen as the hardest, a health-focused approach can be incredibly effective.
And the Netherlands.
The Netherlands, famous for its cannabis coffee shops, demonstrates the feasibility of regulated markets. They generate tax revenue and, crucially, they maintain lower rates of youth cannabis use than many countries with strict prohibition, including the U.S. It shows regulation can coexist with responsible use patterns.
Interesting.
Germany, similarly, uses supervised injection sites and substitution therapies. Again, the pattern holds. Reduced crime associated with drug seeking, improved health outcomes for users, and overall net cost savings for society compared to prohibition.
So what's fascinating here is this pattern. Whether it's full decriminalization like Portugal or specific harm reduction like Switzerland or regulated markets like the Netherlands, the outcomes seem consistently positive. It's not just one country getting lucky.
Exactly. It's a pattern. And if you connect this back to the policymakers and economists listening, these international experiences provide really compelling, real-world evidence. Treating drug use as a health issue first, rather than solely a criminal justice problem, isn't just feasible. It demonstrably leads to better outcomes. Better public health, less crime, economic benefits, reduced stigma, more stable communities. It's a powerful argument for shifting the paradigm.
Okay, so we've seen the historical parallel, the international examples. Now let's get to the core proposal in this paper. This is where it connects back to those innovative governance systems we've touched on before, CCO, PTF, CIP, SCH. The paper isn't just saying legalize and tax, it's proposing integrating drug policy reform into this broader framework.
Precisely. It argues that these systems don't just support reform, they fundamentally enhance it, creating synergies that traditional approaches lack.
Right. So for listeners who might be newer or need a refresher, let's quickly touch on each component and how it specifically bolsters drug policy reform. Let's start with CCO Creative Currency Octaves. Remind us briefly what that is and how it helps here.
Okay, so CCO, as we've discussed in past deep dives, is essentially a dual currency system.
Yeah.
You have basic units designed to cover essential needs, food, housing, healthcare distributed universally, and they have standard currency for everything else. Its impact on drug policy is potentially profound.
How so? Where's the direct link?
Well, first, funding for treatment. Those basic units can directly fund comprehensive addiction treatment for anyone who needs it, without it having to compete for funding against, say, roads or schools in the standard budget. It decouples essential healthcare, including addiction treatment, from political budget battles.
So guaranteed funding for treatment, basically.
Guaranteed access, yes. And maybe even more fundamentally, the universal basic income aspect inherent in CCO, getting those basic units directly tackles economic desperation. So much problematic drug use is linked to poverty, stress, lack of opportunity, hopelessness.
Self-medication, essentially.
Right. When you reduce that baseline economic anxiety, when people aren't constantly struggling just to survive, you reduce a major driver of substance abuse. It provides the stability and resources needed to make healthier choices. It addresses a root cause in a way traditional drug policy completely ignores.
That makes sense. Addressing the why behind the use, not just the use itself. Okay, what about PTF, public trust foundations? How do these community-owned structures fit in?
PTFs, again drawing from our previous dives, are about community ownership of essential infrastructure. Think utilities, maybe grocery stores, housing, and in this context, drug services. They operate not for profit, but on a cost-plus improvement model focused entirely on community well-being.
So how does that apply to drug policy, community-owned treatment centers?
Exactly. Imagine treatment facilities owned and operated by the community through a PTF. Their primary goal isn't profit maximization, it's patient outcomes. They can reinvest any surplus into better services, new therapies, more outreach. It aligns the incentives perfectly with public health goals.
And what about things like safe consumption sites?
PTS could absolutely run those. Adult-only consumption spaces providing medical supervision, clean supplies, immediate overdose intervention. Places designed for safety and harm reduction managed by the community trust.
And distribution, moving away from the black market.
PTFs could handle regulated distribution through dedicated retail outlets. This ensures proper quality control testing for purity, contaminants accurate dosing information, strict age verification, much like alcohol or tobacco, but potentially even more rigorous. And crucially, these outlets can also serve as hubs for education on responsible use and provide clear pathways to treatment services for those who want them.
Quality control, safety, education, all under community ownership.
And one more point on PTFs. They foster community investment in research. Research focused on harm reduction, on therapeutic applications of certain substances, on understanding consciousness, not just on developing the next blockbuster drug for profit. It shifts the focus of research itself.
Okay, CCO for funding and stability, PTF for community-owned services. What about CIP, the Citizens Internet Portal? How does direct democracy via this platform enhance drug policy?
CIP is about leveraging technology for direct democratic participation. It allows distributed knowledge, what people are actually experiencing on the ground, and community preferences to directly shape policy in a much more agile way than traditional politics.
So less top-down, more bottom-up.
Much more. For drug policy, this means CIP could enable different communities to experiment with slightly different regulatory approaches simultaneously. Maybe one area tries a specific model for cannabis, another tries something different. The CIP collects the real-world data on outcomes transparently.
So you get real-time feedback on what's working and what isn't.
Exactly. And policy adjustments can be made quickly based on that data through direct democratic voting or deliberation on the platform, rather than waiting years for slow legislative cycles or getting bogged down in political gridlock. It makes policy adaptive.
And transparent.
Hugely transparent. It ensures all stakeholders, users, families, doctors, community members, even law enforcement can participate in shaping the policy. All the outcomes, costs, and debates are publicly tracked and discussed. This makes it much harder for special interests, whether it's the old prohibition industry or a new legal one, to capture the regulatory process. It keeps it accountable to the community.
Agile, transparent, accountable policy. Okay, one more piece. SCH social zone harmonization. How does geographic sorting help with something as contentious as drug policy?
SEH is about recognizing that different communities have different values and preferences and allowing for geographic sorting based on those preferences. Instead of forcing a single, uniform drug policy on everyone, which inevitably leads to conflict, SCH allows for diversity.
So different zones could have different rules.
Precisely. The paper envisions possibilities like family zones, maybe with stricter rules on public consumption or retail visibility, focusing on shielding children, but still ensuring adults have access to regulated products and treatment. There may be adult recreation zones with more permissive rules, licensed consumption venues, maybe integrating responsible use into cultural life. You could have therapeutic zones, focused specifically on healing, recovery, perhaps facilitating the legal, supervised therapeutic use of substances like psychedelics under strict medical protocols. And maybe traditional zones, where communities that prefer a more conservative approach can maintain stricter regulations while still respecting individual rights and access to essential health services.
So it allows for local control and reduces conflict by letting people choose the environment that best suits their preferences.
Exactly. It reduces those intense policy conflicts while also creating natural experiments.
Yeah.
You can see how different approaches work in different contexts, learn from them, and adapt, all facilitated by the data collected through the CIP. It allows for diversity in learning rather than a one-size-fits-all mandate.
Wow. Okay. This really is more than just tweaking existing policy, isn't it? It's a complete ecosystem. CCO, PTF, CIP, SEH, all working together to address the drug issue from multiple angles, using community power, economic redesign, and technology. It's a fundamental rethinking.
It's holistic. It aims to address root causes: economic insecurity, lack of treatment access, community breakdown, while simultaneously creating safer, regulated environments and empowering democratic control.
Right. Now let's get into the projections, because this is where the paper really tries to quantify the potential impact, which is crucial for anyone making policy or investment decisions. It doesn't just say it will be better, it puts numbers on it.
It does, and it uses a rigorous methodology to do so. Monte Carlo simulations, running thousands of iterations to account for uncertainties, projecting outcomes over different time frames, 2 years, 5, 10, 25, even 50 years out.
Okay, so let's start near term, the 2-year transition period. What happens right away as these systems start rolling out? What are the immediate impacts?
In those first 2 years, the focus is really on implementation, getting the CIP platform up and running for community input, starting construction on PTF treatment centers, beginning the basic unit distribution through CCO to ease economic hardship, and designating the initial SCH zones.
So, laying the foundation, do we see results even then?
Yes. The projections show significant immediate changes. Drug-related arrests are projected to decrease by 45% almost immediately, taking huge pressure off the justice system. Treatment capacity is expected to increase by 67% as PTF facilities start coming online.
A 67% increase in treatment capacity, that's huge.
It is, addressing a massive unmet need. Emergency room visits related to drugs are projected to fall by 23%, thanks to harm reduction measures and safer alternatives. And interestingly, property crime is projected to reduce by 34%, largely linked to the CCO basic income reducing economic desperation.
So, less crime driven by need. What about cost savings in those first 2 years?
Significant annual savings kick in quickly, around $8.4 billion saved from reduced incarceration costs, $12.7 billion from lower police and court enforcement expenses, and $4.2 billion from decreased emergency medical costs. That totals about $25.3 billion in savings annually, just in year 2.
$25 billion a year right off the bat. That's a pretty compelling argument for changes on the financials. Okay, what about 5 years out as the system stabilizes?
By the 5-year mark, the projections show really rapid improvements accelerating. The PTF networks are fully operational, offering community-owned services everywhere. ETCH zones are refined based on feedback via the CIP. Innovations from creator collectives within the CCO framework are being adopted, and the regulated markets are generating substantial tax revenue.
And the health and safety outcomes.
This is where it gets truly dramatic. Drug-related deaths are projected to decrease by 71%. 71%.
Wow.
HIV and hepatitis C transmission among users approaches zero due to clean supplies and testing. Youth drug experimentation actually decreases by 28% again, countering that fear thanks to education, controls, and less allure of the forbidden. And overdose rates overall declined by 89% due to supervised settings, naloxone access, and easy treatment pathways.
An 89% drop in overdoses. That's saving thousands of lives. And the economic picture at 5 years.
It shifts from just saving money to actively generating value. Regulated drug markets are projected to bring in $34.2 billion in annual tax revenue. They create an estimated 420,000 new legal jobs. Healthcare costs decrease by $18.7 billion annually due to better health and prevention.
And socially.
Huge improvements. Families reunified, an estimated 180,000 people a year avoid family separation due to nonviolent drug offense incarceration. Criminal records are cleared for about 2.1 million people with drug-only offenses, opening up opportunities. Community safety improves as police focus shifts. Democratic participation increases by 23% via the CIP.
So what's the net financial picture after 5 years, considering implementation costs?
The cumulative 5-year net savings are projected at $131.1 billion. That's after accounting for about $47 billion in implementation costs. So a very strong positive return even in the medium term.
Okay, let's jump to 10 years. The system matures, optimizes. What does that look like?
At 10 years, the systems are really humming. You see second-generation harm reduction tech coming out of the creator collectives. More international cooperation on this model. Responsible cultural integration is more the norm. Drug-related crime becomes essentially a minor issue, virtually mitigated.
Treatment success.
Treatment success rates exceed 85%. The paper projects, thanks to those integrated holistic PTF-run services addressing root causes, youth education programs are highly effective in preventing problematic use patterns. The whole relationship with substances shifts.
And the annual economic benefit.
The annual net benefit between years 6 and 10 averages around $127.6 billion. That comes from roughly $68 billion in annual taxes, $28 billion in healthcare savings, and $41 billion in productivity gains. The system is now a major economic engine, not a drain.
Now, 25 years out, that's a generational shift. What does the paper envision for society after a quarter century of this integrated approach?
This is where the projections become truly transformative. It's about generational change. Kids raised entirely within this new framework have a fundamentally different, healthier relationship with substances. Cultural norms emphasize responsibility, education, harm reduction. Poverty-driven drug problems are largely eliminated by the CCO's basic income guarantee.
And health outcomes over 25 years.
A health revolution, essentially.
Yep.
Addiction rates across the population decrease by 76%. Mental health improves dramatically as underlying issues are addressed holistically. Overall life expectancy increases by 2.3 years due to reduced drug deaths and better public health.
Economically?
The legal drug industry matures into a major, stable economic sector, employing around 1.2 million people. Innovation spills over into other fields. Tax revenues fund major public programs. Inequality reaches historic lows because of the CCO framework stabilizing the base for everyone.
And the total net benefit over 25 years.
The projection is a net benefit of $5.76 trillion. Let me repeat that. $5.76 trillion. That includes $2.8 trillion in direct cost savings, $1.9 trillion in economic benefits like productivity and innovation, and $1.4 trillion in tax revenue, minus about $340 billion in total implementation and ongoing costs.
5.76 trillion. These numbers are just staggering. It really reframes the whole debate, doesn't it? It's not just about stopping the bleeding. It's about creating immense positive value, lives saved, human potential unlocked, societal fabric strengthened.
Exactly. It shifts the conversation from managing a problem to building a healthier, wealthier, more democratic society. And the paper even looks further out to 50 years.
50 years? What can you even project that far out?
Well, it acknowledges the uncertainty, calling the full impact immeasurable, but it outlines the likely trajectory. This drug policy model becomes a global standard. Mental health and consciousness research advance dramatically. Economic systems optimize for human flourishing. Democratic participation via CIP reaches unprecedented levels.
Quantifiable elements?
It projects things like 2.8 million lives saved over 50 years, 47 million person-years of incarceration prevented, $18.7 trillion in total economic value created, a 257% increase in democratic participation. Addiction becomes a rare medical condition. It's a vision of a profoundly different civilization.
It really highlights how the integration of these systems, CCO, PTF, CIP, SCH, amplifies the benefits. It's not just drug policy reform in isolation.
Precisely. It's a fundamental shift. From scarcity and punishment to abundance and healing, from top-down control to community democracy, from individual pathology to social solutions. A positive sum outcome.
Okay, but no major change like this comes without risks. Even with these glowing projections, there must be potential challenges, hurdles, things that could go wrong. What does the paper say about the risks? And crucially, how does this integrated framework propose to mitigate them?
That's a critical point, and the paper does address risks quite directly. A primary concern often raised is public health specifically, the worry that easier access might lead to increased drug use, especially during the transition.
Right, that's a common argument against reform. How is it handled here?
The mitigation strategy is multi-pronged. First, gradual implementation, not flipping a switch overnight. This allows for careful monitoring through the CIP, tracking usage patterns and health outcomes in real time. Second, immediate and massive expansion of treatment capacity using PTFs, so help is readily available for anyone who needs or wants it. Third, robust public education campaigns focused on harm reduction, responsible use, and health, moving away from ineffective fear-based messaging.
So manage the transition carefully with support and data. What about political opposition? Surely vested interests would fight this.
Absolutely. The paper anticipates significant resistance from sectors that benefit from the status quo parts of law enforcement, the private prison industry, maybe even some pharmaceutical companies.
How do you mitigate that kind of entrenched opposition?
Again, proactively. The proposal includes dedicated retraining programs for workers in affected industries, helping them transition to new roles in public health, community safety, or the newly regulated industries. Gradual transition periods also allow industries and workforces to adapt. And crucially, the CIP's emphasis on stakeholder engagement aims to bring diverse viewpoints into the process, build consensus, and address legitimate concerns transparently, rather than letting opposition derail the process behind closed doors.
Okay, retraining, gradualism, engagement. What about the perennial concern, youth access? How do you prevent minors from getting drugs more easily if they're legal for adults?
This is addressed very seriously. Mitigation includes implementing strict age controls, enforced rigorously at the PTF retail outlets, likely stricter than current alcohol or tobacco controls, using modern ID verification tech. This shifts access attempts from unregulated street dealers to controlled environments.
So move it out of the shadows.
Exactly. Combine that with enhanced evidence-based education programs focused on prevention and healthy choices, delivered through schools and community channels. And utilize the SCH zones for community monitoring, allowing neighborhoods to tailor enforcement and vigilance around schools or youth centers, for instance. The focus shifts from a simple, often ineffective just say no, to creating genuinely safer environments and informed young people.
And once the system is running, how do you ensure ongoing safety, quality, and prevent things from going off the rails?
Continuous monitoring and quality control are baked into the design. Mandatory, rigorous product testing for purity, potency, and contaminants is essential. Clear labeling standards. Medical supervision available in any licensed consumption facilities within PTFs or specific SCH zones. Real-time health monitoring systems, possibly leveraging the CIP to quickly spot adverse reactions or emerging public health trends.
And democratic control remains key.
Absolutely. The CIP platform is crucial for ongoing democratic oversight. It allows for continuous public evaluation of the policies, community input on regulatory tweaks, is this working in our neighborhood, and completely transparent reporting of all outcomes, costs, and potential issues. This transparency and direct feedback loop is designed to prevent regulatory capture and ensure the system remains accountable to public well-being, constantly adapting and improving.
So the risks are acknowledged, but the argument is that the integrated system itself provides the tools to manage them effectively.
That's the core idea. It's designed to be adaptive, transparent, and responsive in a way that current systems or even traditional reform models often aren't.
And this vision, it doesn't stop at the U.S. border, does it? The paper talks about international implications, spillover effects.
Right. It argues that successful implementation of this integrated CKO, PTF, CIP, SCH drug policy would create significant international competitive advantages for the nation or regions that adopt it.
Competitive advantages? How so?
Primarily through migration and capital flows. The paper predicts a potential brain drain from other nations. Talented individuals, scientists, entrepreneurs, artists, families would be attracted to places offering greater personal freedom, better civil liberties, access to advanced treatments for addiction and mental health, huge economic opportunities in the new legal markets, and the chance to participate in genuine community-based democracies through the CIP.
So people would vote with their feet, essentially, moving towards a system that offers better well-being and opportunity.
That's the projection. And alongside people, capital would follow. International investment would naturally gravitate towards regions with stable, rational regulatory frameworks, exciting innovation opportunities, especially in consciousness research and therapeutics, lower social costs from reduced crime and incarceration, higher workforce productivity due to better health, and access to advanced harm reduction tech. Capital seeks stability and growth.
So it creates this pull factor for talent and investment. What about influencing other countries' policies?
That's the other side, global policy diffusion. Success in one major nation would create powerful demonstration effects. Other developed nations would likely feel pressure to adopt similar frameworks to remain competitive and address their own drug policy failures. It could spur renegotiation of international drug control treaties, shifting the global consensus away from prohibition towards health-based approaches, maybe even influencing UN policy.
And nations that don't adopt it.
They risk facing reduced economic competitiveness, continued brain drain, the ongoing burdens and costs of drug-related crime and violence fueled by prohibition, leading to both internal and external pressure for reform simply to keep up. It sets a new global benchmark for effective, humane, and economically sensible policy.
So the argument is that this isn't just about fixing a domestic problem. It's about pioneering a model that could have profound global consequences, reshaping international norms and competition.
Yes, it presents it as a potential catalyst for global change, driven by the clear benefits demonstrated in the adopting regions.
Okay, finally, let's bring it all together. The paper makes its most direct case, comparing this integrated approach not just to the status quo, but also to more traditional reform models. Why ultimately does it argue that this CCO, PTF, CIP, SEH framework is truly superior?
It lays out a stark comparison. First, it reiterates the performance of the current prohibition system, calling it, as we discussed, a systemic failure. Economically, that negative $3.40 return for every dollar spent on enforcement, plus the $9.7 trillion opportunity cost. It's just incredibly inefficient and destructive from an economic standpoint.
Right, the baseline is failure.
Then public health. Prohibition actively worsens health outcomes, the 340% increase in drug deaths, the spread of HIV, Hep C, the barriers to mental health care. And socially, it drives systematic inequality. The racial disparities in arrests and sentencing, the 15 million arrests disrupting lives and communities, destabilizing families. The status quo fails on every front.
Okay, that's the baseline failure. What about traditional reforms like Portugal or just legalizing and taxing cannabis? How does the paper compare the integrated model to those?
It acknowledges that traditional regulatory frameworks, based on international evidence, offer substantial improvements over prohibition. You see that 18% decrease in social costs, maybe $15–25 billion annually in new tax revenue, hundreds of thousands of legal jobs, dramatic decreases in drug deaths, 45–70%, and HIV transmission, 85–95%, less crime, more stable families. These are real, significant gains and far preferable to prohibition.
So traditional reform is clearly better than prohibition, but the integrated model goes further.
Yes, that's the core argument. The CCO, PTF, CIP, SEH system achieves transformative optimization by layering synergistic benefits on top of traditional reform.
How? What are those extra layers?
Economically, CCO's basic income directly tackles the poverty-driving problematic use, something simple regulation doesn't address. CCO's career collectives accelerate harm reduction innovation. PTF's ensure treatment centers optimize for patient health, not profit. CIP's democratic allocation prevents regulatory capture by industry interests, ensuring policies serve the public. Health-wise, it provides truly comprehensive integrated care through community-owned PTFs, focusing on prevention and root causes, mental health, trauma, alongside addiction treatment. It's a holistic health system integration.
And democratically.
CIP provides that direct participation, rapid adaptation based on real-time data. SCH reduces conflict through geographic sorting and local tailoring. Transparent governance via CIP builds trust and mitigates corruption. And socially, it enables zone-based experimentation, builds community cohesion through PTF ownership, fosters cultural integration to reduce stigma, and takes an intergenerational approach to truly address the roots of the problem across society.
So the argument is that while traditional reform is good, This integrated model is optimized. It addresses underlying drivers, aligns incentives with well-being, empowers communities, and creates positive feedback loops that traditional models lack.
Precisely. It moves beyond simply managing or taxing a substance towards fundamentally redesigning society's relationship with drugs, mental health, economic security, and democracy itself, aiming for maximum human potential and social well-being. It's presented not just as reform, but as a paradigm shift.
We have covered a lot of ground today. We've really dived deep, uncovering how the paper argues current U.S. drug prohibition has cost nearly $10 trillion over 70 years while fundamentally failing to achieve its own goals.
And we looked at compelling evidence, both historical with alcohol prohibition and international with countries like Portugal, showing that treating drug use as a health issue, not just a crime, leads to dramatically better outcomes: less death, less disease, less crime, lower social costs.
But the core vision, presented by Duke Johnson and Claude AI in this paper, integrating CCO, PTF, CIP, and SCH, really transcends that traditional reform. It offers a blueprint, a detailed, economically modeled plan, not just for saving money, but for generating trillions in new economic value.
Trillions in value, saving potentially millions of lives over time, fostering genuine community cohesion, and radically enhancing democratic participation in shaping local policy.
So for you, our listeners, particularly those in policymaking, in journalism covering these issues, in economics studying social costs and benefits, the takeaway from this paper isn't just academic. It presents itself as a detailed, economically sound rationale, and perhaps even a moral imperative for considering a truly transformative shift.
It reframes the entire debate, moving beyond the simplistic prohibition versus legalization dichotomy.
And maybe a final thought to leave you with, something the paper touches on. This transformation from prohibition to this kind of integrated regulation, it represents more than just policy change. It embodies a fundamental shift, a shift away from scarcity-based punishment towards abundance-based healing, away from top-down control towards community-based democracy, away from focusing on individual pathology towards finding social solutions.
So think about what that deeper shift might mean for your field, for your work. How could addressing the root causes of social problems, poverty, lack of healthcare access, community breakdown, rather than just managing the symptoms, how could that unlock unprecedented human flourishing? Especially in a world facing rapid technological change and shifting economic landscapes.
It's a big question, worth pondering. We definitely encourage you, if this has sparked your interest, to seek out the working paper itself. Drug Policy Reform and Integrated Economic Governance by Duke Johnson and Claude AI. Delve into the full arguments, the data, the projections for yourselves.
Join the crucial conversation that this kind of thinking sparks.
Thank you so much for joining us on this deep dive. We hope this exploration has given you some profound insights, maybe challenged some assumptions, and sparked some new ways of thinking about one of our most complex and enduring societal challenges.